High blood sugar symptoms at night. Most people believe that health problems show themselves clearly during the day. Pain, fatigue, dizziness, or weakness are the signs we are taught to watch for. When something feels wrong, we expect our body to speak loudly and directly. But the truth is very different. Some of the most serious health issues do not announce themselves with pain. Instead, they reveal their presence quietly, slowly, and often at night. High blood sugar is one of the clearest examples of this. At night, the human body is designed to rest and repair. We stop eating. Physical activity drops to almost zero. Hormones shift into recovery mode. The nervous system calms down. Under normal conditions, blood sugar levels should remain relatively stable throughout the night. This is why nighttime is such an important window for understanding metabolic health. When blood sugar rises during sleep, it is not random. It is usually a signal that the body's ability to regulate glucose is no longer working efficiently. Unfortunately, because this happens while we are asleep, many people fail to recognize the warning signs for years. One of the earliest and most common symptoms of high blood sugar at night is excessive thirst. People wake up with an uncomfortably dry mouth, cracked lips, or a sticky feeling on the tongue. Some describe a burning or tight sensation in the throat. They drink water immediately, sometimes large amounts, yet the thirst returns again and again throughout the night. This is not simply dehydration from the environment. It is a biological response. When glucose levels in the blood are high, the blood becomes more concentrated. To protect vital organs, the body pulls water out of cells to dilute the excess sugar. As cells lose water, the brain activates powerful thirst signals. This is why nighttime thirst caused by high blood sugar often feels intense and urgent, not mild or occasional. Many people explain it away by blaming air conditioning, salty food, or dry weather. But when thirst repeatedly interrupts sleep, it deserves attention. Closely connected to thirst is another common symptom: frequent urination at night. Many people with elevated blood sugar wake up 2, 3, or even 4 times during the night to use the bathroom. The amount of urine is often large and clear. After returning to bed, thirst quickly follows again. This is not normal aging, nor is it simply drinking too much water before bed. When blood sugar levels exceed what the kidneys can safely reabsorb, the kidneys are forced to remove excess glucose through urine. Glucose pulls water with it, increasing urine production. This creates a vicious cycle. High blood sugar leads to frequent urination. Frequent urination causes dehydration. Dehydration, in turn, raises blood sugar even further. Over time, this constant strain damages kidney function and weakens blood vessels throughout the body. Sleep quality is another area deeply affected by high blood sugar at night. Many people do not realize that their sleep problems may be metabolic in nature. They struggle to fall asleep, wake up multiple times without a clear reason, or sleep for many hours but still feel exhausted in the morning. They often describe their sleep as light, restless, or unrefreshing. High blood sugar disrupts the balance of key hormones involved in sleep. Melatonin, the hormone responsible for initiating and maintaining sleep, becomes suppressed. At the same time, cortisol, the body's primary stress hormone, remains elevated. This keeps the brain in a state of alertness when it should be resting. The body behaves as if it is under threat, even though the person is lying safely in bed. As a result, true deep sleep becomes difficult to achieve. Many people assume that stress causes their poor sleep, but in reality, unstable blood sugar may be driving both stress and insomnia. The relationship works in both directions. Poor sleep worsens blood sugar control, and high blood sugar further damages sleep quality. Without intervention, this cycle can continue for years. Another symptom that often appears at night is excessive sweating. Some people wake up with damp sheets or clothing, even when the room temperature is cool. Others notice sudden episodes of warmth, discomfort, or restlessness during sleep. In some cases, the heart may begin to race, accompanied by feelings of anxiety or unease. These reactions occur because blood sugar imbalance can overstimulate the nervous system. The body enters a stress response, activating systems designed for emergency situations rather than rest. Because this happens during sleep, many people mistake these symptoms for anxiety disorders, hormonal changes, or bad dreams. While those causes are possible, Blood sugar instability is often overlooked as a contributing factor. What makes nighttime symptoms of high blood sugar particularly dangerous is their subtlety. There is no sharp pain to force immediate action, no dramatic event that demands attention. Instead, there are small disruptions, waking up thirsty, using the bathroom repeatedly, tossing and turning, that slowly become part of normal life. People adapt to them without realizing that damage is occurring beneath the surface. Night after night, elevated blood sugar quietly harms blood vessels, nerves, and organs. The heart works harder. The kidneys remain under constant pressure. Inflammation increases. Over time, the risk of serious conditions such as type 2 diabetes, cardiovascular disease, and nerve damage grows steadily. The body often speaks most honestly when we are asleep. During the day, we distract ourselves with work, movement, and stimulation. At night, those distractions disappear. What remains are the body's true signals. If you regularly experience intense thirst at night, frequent urination, poor sleep quality, night sweats, or unexplained restlessness, these are not signals to ignore. High blood sugar does not shout. It does not announce itself loudly or dramatically. Instead, it whispers, night after night, hoping you will listen before the damage becomes severe. Recognizing these quiet signals early can make a profound difference, not only in blood sugar control, but in long-term health and quality of life.